And finally, we have up on LarryElder.com an article from the New York Times. Headline, Malaria Drug Helps Virus Patients Improve in Small Study. And my point simply is, when it's an article like this, in a paper as prominent as the New York Times, and when people are desperate, they're going to want to have the drug to possibly save their lives or to minimize the effects of the coronavirus. The small study was in China, in Wuhan, so I'll leave it up to you to determine whether or not you want to think that study might be credible. But also reports from France also seem to suggest that the drug is helping patients. The study was 62 patients, average age 45. There was a control group, meaning a group that did not get the drug, and it was conducted at a hospital in Wuhan. And half the patients were given the usual care of coronavirus, and half were given the usual care plus hydroxychloroquine. And turns out that the coughing and fever eased a day or so earlier in the patients who received the hydroxychloroquine. The illness turned really severe in 4 patients. They were all in the group that did not get the drug. 2 patients had minor side effects from the drug. 1 had a rash. 1 had a headache. And again, these results applied to patients with only mild illnesses and cannot be generalized to the advanced cases, and it was a very, very small study. All I'm saying is that this is why people are suggesting that this might possibly help something. And President Trump talked about the drug being used on 1,100 new workers last week.
I want to point out that the
New Yorkers.
Hydroxychloroquine is being administered to 1,100 patients, people in New York, along with the Z-Pak, which is azithromycin. And it's very early yet. It started 2 days ago. But we will see what happens.
And this doctor said that data from Europe suggests that it might shorten the illness.
Well, I think it adds to our knowledge. The data from Europe seem to suggest that hydroxychloroquine, either alone or in combination with the antibiotic azithromycin, might shorten the course of illness. And this randomized trial from China does seem to support that we can shorten the illness.